the antiplatelet therapy portion of the document in particular jumped off the page, especially with the inclusion of rivaroxaban and ticagrelor in that group. I know we've seen a lot from both of them. What new information is included in this from recent years' data that helps influence the way or helps guide the way clinicians can treat these patients?
Among other aspects of this document, we did try to incorporate the latest in antithrombotic therapy. Of course, there have been a lot of developments in the past, even I could say several months, even the past few weeks, as a matter of fact. And the document tried to include everything up to date as possible. And there are trials, of course, such as THEMIS and THEMIS PCI that came out just this past summer at the European Society of Cardiology in 2019, where aspirin ticagrelor was shown to be efficacious for people with diabetes and stable coronary artery disease. Really, those data came out towards the end of our writing process, but we did try to incorporate those important trials and concepts. Very recently, I presented the COMPASS diabetes data about aspirin and low-dose rivaroxaban. Of course, that was too fresh and hot off the presses to incorporate in this document. But we did try to really hammer home the fact that in people with diabetes and stable coronary artery disease, while many practitioners might be anchored to using aspirin, in fact, there's data that in many patients who are having diabetes and coronary artery disease, if they're at low bleeding risk, perhaps they should be on more than just aspirin, whether that's dual antiplatelet therapy or dual pathway inhibition with a low dose of rivaroxaban. You know, that's really a much more subtle sort of issue and discussion, but we do try to hit upon all those points just to make sure that that physician who's caring for the patient with diabetes and stable coronary artery disease realizes that at this point in time, for some patients at least, more than aspirin is appropriate.